Hi, I'm Rob from Dentally. Today I'm going to walk you through a very simple patient journey. When all departments do their job properly, the patient journey can be very fast and fluid. We are going to start with what your receptionist needs to do when a patient arrives. When a patient arrives at your practice, you will need to inform the practitioner that the patient is here. You can do this by changing the patient appointment status to arrived. Now you can check you have the patient's correct information by entering their record. If this is an NHS patient and they are exempt, you can enter those details in the exemption tab. Once your receptionist has gone through these steps, they can now advise the patient to take a seat in the waiting room. Now let's see what the practitioner does. The waiting list shows which patients have yet to be seen. Click on the patient's name to go to the patient's record. This will also notify reception that the patient is now in surgery. To create a new course of treatment, click the plus button. Now you can start creating your treatment plan. There are 3 ways to find your treatment items. You can scroll up and down the list, you can search by category, or simply search for the item. You can favourite an item that you find yourself using a lot. If the item is a general treatment, then double click it to add it to the treatment plan. If the treatment is tooth specific, then you will need to select the tooth and, where applicable, the surfaces it will cover. To chart multiple surfaces, hold the Alt key as you click each surface. This completes your basic treatment plan, but I think you can handle some more, so let's carry on. We can now organise our treatment plan into appointments. We do this for 2 very good reasons. By setting the length, it will tell reception how long you require for the appointment. You can also leave a small note to aid them in the booking process. When you create an estimate, it will also show the 2 appointments. This gives more information to the patient. Now let's show you how to add your clinical notes. To add your notes, you can click on the treatment item for it to expand. This box allows you to enter your notes or alter the properties of the item. In the settings menu, you can configure some template notes to always appear when you use this treatment item. Once you've finished, click Save. When you've finished treating the patient, you can complete the items in the treatment and click Charge. If the entire treatment is finished, you can submit if the patient is NHS or complete it for other payment plans. At any point during this process, you can update the base chart, carry out a BPE, or upload any clinical photos. The surgery team can repeat this process with our next patient. Now it's time to see the final part back in reception. When your patient arrives back on the desk, you will need to open the patient's record to see what is required. Click on the patient's name to bring this up. The details page will show you if there is an outstanding balance. If you go to the appointment section, it will present you with any appointments you need to book. Dentally doesn't mind what you do first. You can either book the required appointments or take the payment. For this example, we will book the appointment first. To book the appointment, you need to take the information to the calendar. We do this by adding the appointment to the clipboard. This simple process means the appointment is waiting for us when we go to the calendar. We can find a space and drag the appointment into it, or you can use the magnifying glass and let Dentally do the hard work for you. Now let's process the payment. From the patient's account screen, select Take Payments. Enter the method of payment, who the money should be allocated to, and the payment plan. Now click Save. From here, you can say goodbye to your patient. The patient journey is something you will do over and over again. This may look complicated, but you'll master it in no time. Thanks for watching.